Vice President Kamala Harris has tested positive for COVID. The news comes as COVID cases and hospitalizations are again rising nationwide. And the White House today was posed to announce a new plan to expand access to treatments for COVID. Joining me with the latest on the fight against COVID, ABC News medical contributor Dr. John Brownstein and ABC's Ann Flaherty, along with ABC News' Alex Boucher here at the anchor desk. So, first, Ann, what do we know about the Vice President's condition? And given who she is, woman in good health, a good age, is there a concern that about her health, and what about the president, about whether he might have been exposed?
Well, Terry, the White House is telling us that the vice president is not experiencing symptoms at this time, that she did test positive via a PCR test, and that is a more sensitive test that can pick up on even the smallest strains of that virus. So what we do know now is that she goes into what they call isolation for at least 5 days. Day 0 will be the first day of her symptoms, or the first day of her test in her case. You have to stay in isolation under CDC guidelines for at least 5 days. If you have no symptoms after that point, no fever, then you can leave isolation, but you should continue to wear a mask for another 5 days. The White House telling us that they don't think that she had any contact with the president, but of course, the vice president's going to come with a big entourage. She's going to come with Secret Service. They are probably going to be alerting those people that they may have been exposed, and if those people have comorbidities, that could be a concern for them. One question I have is if they will be offering the vice president Paxlovid. We've asked that question. This is the antiviral pill that can reduce your chances of being hospitalized, but at this point, no real concerns that she could become seriously ill. She doesn't have a lot of the comorbidities that we've seen with COVID.
Okay, thank you. And let's go to Dr. Brownstein on some of this. The news comes, Doctor, the same day White House is announcing its plan to get that COVID treatment, Paxlovid, out to more Americans, doubling the number of pharmacies that stock that drug. So just what's your sense of how this would impact a woman in Kamala Harris's age group and apparent good health? And more broadly, this move to get this Paxlovid drug out to more people, how do you think it'll help in the fight against COVID?
Well, it's an incredible treatment, and it's exciting to see that it'll have broader availability. The vice president, of course, will have access to Paxlovid, and I'm not surprised if she would get prescribed it, but we'll have to see. But more generally, we know that this pill can reduce risk of hospitalization and death by 90%. So making it more widely available means that those who would be eligible for this drug can actually get it for the first time. There's been over 44,000 infections each day, but we're only seeing about 55,000 Americans each week getting this drug. So doubling the availability, doubling the number of sites just means that those who are in need will get this drug, and it will have an impact on hospitalizations and deaths. And of course, we're in a small amount of surge, at least now, with these BA2 sublineages. So it comes at a really good time to sort of help fight against that increase in cases. Clearly, we're going to have to figure out access. We've seen these challenges with vaccinations and therapeutics, making sure that these are equitably available to everyone. That's still going to be a challenge that the White House is going to have to face in the coming weeks.
Absolutely, but it is good to hear what a strong drug this is, what a remedy this is for COVID, protective remedy. And the biggest question from a policy perspective seems to be why now? This pill was approved in December, and one wonders why wasn't this on the shelves and available for more people during the last surge?
Well, of course, Pfizer needed time to build up production. I mean, this was a very promising pill that the administration was very excited to get out there, but it needed time to produce it. They also needed time to test it, so that's why you didn't see it arrive in time for Omicron. That was really the sad news earlier this year, that many people who wanted that drug did not get access. The administration was telling us at the time they expected April to be the month where it would be more widely available. Of course, it was this morning that they announced that they were expanding this to many pharmacies. I think 20,000 pharmacies were on the list to be added. People can go to these pharmacies, ask to be tested. If you don't have insurance, you might be charged an administrative fee for that test. But otherwise, these pills should be free. They've already been purchased by the government. People need to know that you need to take them right away after you've tested positive for COVID, because that's the only way that they work.
Well, that's great. Alex Boucher, I want to ask you back to the vice president. She has access to this drug, but as Ann mentioned, they're now going to contact trace. So have you got any sense of her movements and who she might have been in contact with?
Well, what we've learned so far, she was returning from a trip out to L.A., landed the 25th. She was not at the president's daily briefing this morning. And also we know that the big question that everybody's been asking is, well, when was the last time that she had contact with President Biden? To our knowledge, the last time the two were seen together was the week of that Easter egg roll, which was April 18th.
And so he'd be out of the window of...
He'd be out of the window. We do know that she's had some close contacts in the past. Obviously, the second gentleman has tested positive for COVID. Her communications director, Jamal Simmons, tested positive following the Gridiron dinner. And then certainly both she and the president weeks ago were both around Nancy Pelosi, who tested positive subsequently after their being together.
Great. And if I can go to Dr. Brownstein on this. Doctor, you've been with us so many times over the course of this pandemic. And here we are, we're reporting on the vice president because she's, you know, a heartbeat away and all the rest of it. But it is more and more common, right, that we know people in our own lives who have had COVID. How much concern should people have when they hear that a child in their child's school, or somebody, somebody that they know, a neighbor might have had COVID? How big a news story is this? Is one of the things I'm asking.
It's a really good question. I mean, for someone like the vice president who's fully vaccinated, boosted twice, the outcomes are going to be really good. I mean, I think that we recognize that the risk of infection really dramatically lowers. And I think overall, we're recognizing that infections, especially breakthrough infections, are becoming less of a big deal. That being said, we still have kids that are under 5 unvaccinated. We still have many vulnerable members of the population that still can't mount an effective response. So even though overall the vaccines are doing such an incredible job, we still have this concern of an emerging variant. We have these sublineages of the BA2 variant that are now taking hold. So there is pockets of risk and there are concerns. And there's especially concerns for those who remain unvaccinated, unboosted. Yes, we have these therapeutics at our disposal, but those are second-line defense. First line is if you're eligible, get that vaccine, get boosted, and then COVID infections really start to become a non-story.
Yeah, that's a great point too. That within that it remains our obligation and will in the foreseeable future to protect the vulnerable, those who can't get the vaccination, who are immunocompromised. But Ann, on the topic of vaccines, as Dr. Brownstein was just saying, it's so important. Really, that's what renders it more normal. Parents still anxiously waiting to learn how soon before we'll see a vaccine for those children under 5 years old. What's the holdup? What can you tell us?
Right. Those early trials did not prove to be as promising with Pfizer as they had hoped. Omicron had really undercut the efficacy of the vaccine. Moderna now out with a 2-shot. They say that they're going to be asking the FDA for authorization this week. So we're expecting that will kick off an FDA review that could take several weeks. One question that we have is whether or not the FDA is going to hold on to that data that Moderna gives them and wait to see what Pfizer says about its 3-shot vaccine. I've been speaking with parents who are frustrated. They are ready to vaccinate their kids under 5. They say they're tired of living in COVID. Everyone else has moved on. They haven't. So they're very eager to get that vaccine, and they're trying to pressure the FDA into doing, moving as fast as they can. What the FDA tells us, they want to check all their boxes on this one. They want to make sure that they get this one right, and they will move as fast as they can.
Yeah, absolutely. And one of the blessings of this pandemic inside is that it really didn't hit the young ones very hard at all. So Ann Flaherty, Dr. Brownstein, Alex, thanks very much.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.